I'm Patrick Daly and I'm one of the team at the Rural Doctors Association of Australia. It's often been said you can take the kid out of the country, but you can't take the country out of the kid. And it's a phrase that's true to a T for the junior doctor featured in our podcast today. RDAA and our generous long-term sponsor MDA National offer 7 bursaries each year to support junior doctors in attending a rural health conference, a clinical placement in a rural community, or a skills workshop in a rural town. Last year, 3 of the bursaries were earmarked to support junior doctors to attend the Rural Medicine Australia conference in Canberra. I spoke with one of the recipients, Dr Isobel Pye, in the weeks leading up to the conference about her journey into medicine, her passion for dermatology, and her equally strong passion for working as a doctor in a rural setting. It's been a compelling journey for her and well worth a listen. Before we begin, I'd like to acknowledge the traditional owners of the land we meet on across Australia as we listen to this podcast. I'd also like to pay my respects to elders, past, present and emerging, and welcome any Aboriginal and Torres Strait Islander listeners who may be joining us. Isobel, thanks very much for joining me today. Can you tell me a little bit about your childhood? You were raised on a property near Walgett in northwest New South Wales. Tell me a little bit about that.
Yeah, thank you so much for having me, Patrick. So yes, I was raised and where my family still lives on a farm that's about 30 kilometres out of Walgett, in between Walgett and Canberra. So our farm is actually as remote as it gets, the category 7. So yeah, I spent from 0 to 12 there, and then went to boarding school in Sydney and have been unfortunately stuck here ever since, more or less. But yeah, so growing up in Walgett was a seriously important part of my life that shaped who I am today.
Did you miss Walgett when you went away to boarding school?
Yes, I did. And in saying that, I think at the time I missed my horses a lot. I've been heavily involved in horse riding my entire life, and as well as my family and basically all of my cousins. There's a lot of jokes that everyone in Walgett's related. So it's a really, really tight-knit and strong community out there. So it was a bit of an adjustment going to Sydney, although I did have 2 of my cousins with me at the same boarding school. So that certainly made it a lot easier. I went home every holidays back to Walgett, and either going to horse events or helping Dad out with sheep work on the farm. There's always plenty of that.
So what got you interested in medicine, and I guess particularly rural medicine?
Yeah, so, well, personally for me, it's a bit of a personal story, which feeds into sort of my interest in dermatology as well. I had suffered from really bad eczema as a kid. So from a very early age, I had such bad disease that I had recurrent skin infections. I missed days of school. Walgett's pretty hot, and even in the sweltering days, and it sometimes hit 50 degrees, like I was often too embarrassed to go swimming with the other kids because of how much or how obvious my eczema was on my skin. This led to a lot of sleepless nights, and again, I think the most important thing for me was not being able to ride my horse a lot of the time because I was suffering so badly. So there was not much help available in town. The GP we had in town was there on sort of a 2-week rotating basis with the other surrounding rural towns. So this meant that it was very difficult to A, get to see medical care, but B, also to get that focused specialty dermatology care. So it wasn't until I was fortunate enough to eventually go to Sydney and see a dermatologist that it really changed my life and put me back on track and got me living like any 6-year-old would on the farm, knowing how to manage this disease.
Has access to dermatologists changed since that time in terms of being able to access dermatologists more locally for rural kids, do you think?
So thinking specifically for the northwest New South Wales, our nearest dermatology service was previously Dubbo, which has very recently closed down. So This is not good news for northwest New South Wales. It means that the nearest one would then be in Orange, where there are a couple of dermatologists there who are completely swamped and have waiting lists that are just out of this world. So a lot of traveling, a lot of waiting, just not enough care, no. There are actually a few outreach clinics that go to a lot of rural towns, including Walgett. So amidst outreach clinics, which happen, maybe 4 times a year, and having the nearest dermatologist in Orange, things are pretty grim.
What about in terms of the next crop of dermatologists coming through? Do you sense that there are many who are keen to take up regional or rural postings as dermatologists?
Yeah, so I think the College of Dermatologists is certainly doing a great job with the limited number of training positions that they have. So dermatology is a very close-knit group of individuals, and some of the issues with it, there are certainly a lot of people or some individuals who will work rurally and have that passion and share that with myself. But the issue is being able to nurture that passion with actually training them rurally. And for a specialty such as dermatology, they need the training is quite very intense and requires access or experience with a number of skin conditions and also support, which is just not available when there are no consultants in the country. So it's a complicated space, but there's lots being done, lots being done, and particularly in developing and further developing the provision of telehealth and store and forward technologies to better service those areas, but also better support trainees in rural and regional areas as well.
Can you see this as being a way to extend access to training for trainee dermatologists in rural areas?
Yeah, so I suppose, and look, the importance of that is that people who have rural passions like myself, particularly at the age or that I'm at, I certainly haven't. I think the issue is in training in the metropolitan areas such as Sydney, the kind of risk you run into is meeting a partner and sort of settling down in a city because you're kind of more or less here trying to get the dermatology experience that's needed for the application. So we all know that when junior doctors do spend more time out of rural and regional areas, there is a risk that you sort of lose them to the cities. So there's that. But getting back to your question, yes, I think that having exactly so getting people to stay in rural and regional areas and be able to complete their training there through the supervision of maybe an in-person supervisor, but also having that teaching from over digital means, I think is going to be the way forward in terms of at least initiating getting more rural dermatology trainees out there.
What have been the wider challenges and highlights of your junior doctor years and your intern years so far?
Yeah, so I had a pretty unique start to my junior doctor years. I had been I suppose, normal intern for maybe a month or two, and then COVID hit. So pretty much my whole working life has been with COVID, which is a tremendous challenge that's still obviously here. In terms of other challenges, I suppose I did my internship residency at RPA in Sydney, which was fantastic learning experience. And I chose that hospital actually because I knew I could do a rotation in dermatology and I could do a rotation in melanoma surgery. And they were both fantastic opportunities, although it would have been ideal if I could do those in rural areas, but nonetheless. So that was a challenge. That's been a challenge for me this whole time, is trying to link rural health with dermatology. In terms of my highlights, certainly the highlight of my junior doctor career was spending 10 weeks in Broken Hill. So I did palliative care up there with the very inspiring Dr. Sarah Wenham. And I will never forget, because really it was the first time I had worked in a rural area as a doctor. So it was incredibly fulfilling and so enlightening to learn from such inspirational people. And I took the opportunity to really ask and try to learn about the specific challenges that a specialist has in a rural area, because I knew this is the pathway that I'm interested in pursuing. So yes, very much a career highlight. Highlight there. Yeah.
What made you choose palliative care for your residency placement? What was it that interested you about that field of medicine?
So as being a junior doctor, I mean, since I was a medical student, I've always been interested in dermatology, but I've also known that I want to work rurally. And in doing that, you kind of have to be more of a generalist dermatology, if that's a new phrase I'll coin. But I tried to keep my options open. I tried to make sure that I was learning a wide breadth of skills that I can take to a rural area, which will only make me a better doctor. And palliative care was one of those particular areas that I had very little knowledge in. And it is such an important area that I believe, or many people believe, that every doctor, regardless of their specialty, should know how to palliate a patient. And while dermatology is one of the specialties which, often doesn't need to palliate patients, there certainly are instances where a dermatologist with those particular skills, I think, would be of a huge benefit for their patients.
Tell me, I guess, the positive outcomes of your time in Broken Hill, what you really took away from it as being some of the most positive sort of experience that you had there.
Yeah, so I think the one of the most positive experiences was the humanization that I've felt. Really, like, I'd come from a large Sydney hospital where a lot of the consultants would not know my name. They wouldn't know my story. They wouldn't know my passions, just because things are so busy and it's a different culture. But out in Broken Hill, everyone knows your name. They know your whole story because they want to know. They're interested in you. You're an individual human, and I often became quite overwhelmed by emotion with my team, because I felt so valued as a junior doctor. I felt as if I was really contributing to the team and to my patients and to Broken Hill Hospital as a whole. And that I will never forget, because even after I'd come back to Sydney amidst the COVID lockdown, I've been sent 2 or 3 packages of goodies from the Broken Hill Palliative Care team, who I'm still in contact with. So nothing but positive experiences there in terms of that. But I had the chance to really nurture my interest in seeing and experience as much as possible. And I was able to go out to Menindee for visits, and I was able to visit Wilcannia Hospital as well. I was really able to do anything that so interested me, and it was made possible just by the team wanting to really nurture that curiosity.
And that personality of care for you, I'm guessing, also shows through to the care of patients in terms of the focus on patients and their background.
Yeah, exactly. I mean, it's a place where everyone's interesting and everyone's interested in each other. It's a community, and it's something that I grew up with, but it wasn't. I hadn't experienced yet that in a career in medicine so much. And look, that's probably a lot to do with COVID in the major hospitals in Sydney, but Broken Hill was a very, very special place, and I'd really recommend for any junior doctor to go out there or to other rural towns, because I think about it every day, and I was out there over 18 months ago. So it was awesome.
Tell me about your involvement with the Eyes Wide Open project too. It sounds really interesting.
Yeah, so when I was a medical student, I spent a year in Wagga, and one of the one of the medical students at the time junior doctors had set up this project, which was aimed at mentoring high school students within the Wagga area into medical school, really. So any high school student that had expressed interest was sort of buddied up or paired with a medical student like myself, and we mentored them through the whole year, and were able to answer any questions and share our story, and just be there for anything. And I think this was great, that it was really fulfilling to have it as a year-long project, because at the start it was a bit overwhelming for the students, but knowing that you were there and available to talk and guide them when it suited them, and once they'd digested the last bit of information and when they had burning questions, was a really great project.
Because for many high school students in rural areas, it can seem a step too far to get into medicine.
Yeah, absolutely. Yeah, completely. And I've spoken to now a lot of medical students through my involvement with the Rural Doctors Association of Australia and the Rural Doctors Network, and they it's that I've heard stories about careers advisors having either no idea how to get into medicine, or completely discouraging that student and saying it's not possible. You'll never get the marks. You'll never be able to do X, Y, Z. Fortunately for me, I did go to school in Sydney, and that wasn't the case for me. But hearing that really breaks my heart, that has happened, and I'm sure does still happen. And I know that there are very motivated medical students actually trying to compile information packs to give to career officers in rural areas, so that should never be a response from a careers officer, that students should always have the information available if they want to pursue this, but they also mightn't have even considered it.
Back in Sydney, you were working as a volunteer medical officer with Street Side Medics. I'm just interested to know a little bit about what sort of exposure to that side of medicine you gained from, or you are gaining from, your volunteering in that area, and how it's going to shape how you practice medicine in the future.
Yeah, so this has been a really interesting sort of thing I do on the side. So Street Side Medics is a organisation that was set up by a junior doctor like myself, who actually got the Young Australian of the Year award. So it's for me, I volunteer on either a fortnightly or monthly basis, and go to usually places with high homeless populations. And we, in the van, I'm sort of as the junior doctor, I see the patients first and understand their condition, but also come up with a management plan that's tailored to their circumstances. And this is a skill that it's a unique thing for me to learn, because in the hospital system, you have all the resources available. You have the scans, you have the drugs, you have you have the allied health, you have the team. But when you're seeing a patient who has little to no, or maybe no financial means, very little knowledge of what their medical condition is, it's a real, you really have to think on your feet and be creative and be practical with your solutions. So how this might look is a patient can come in. I saw a patient the other day with chronic venous disease, and how we'd usually treat that is leg elevation and using topical corticosteroids and maybe some compression bandages as well. And this was a homeless gentleman who spent most of his days walking around. There was no way that he was going to be able to elevate his legs for long periods of time. There was no way he was going to be able to access compression stockings. Fortunately, we did have some topical corticosteroids to treat his stasis dermatitis that we were able to hand him from the van. But I really had to go through his history and think about where we could implement these changes and really work with the patient as very much a member of my team. And it's been a great experience to do, and really opens up a different side of my brain when I go there. And the GPs are fantastic. There are lots of volunteers there who are just unreal, and I really look forward to my time there.
Now, if that's not enough for everything you're doing at the moment, you're also involved in some research projects. Can you take me through some of those and let me know a little bit about what you're doing in that space?
Yeah, so I suppose a big project I've been working on for a few years now is in relation to melanoma. And melanoma's been a soft spot of mine because my grandfather was died of metastatic melanoma when my mum was only 12. So this left my grandma in a town called out near Corinda, in a farm, which is about an hour and a half out of Walgett. Left her to raise 5 young children then out in this very isolated place. So, and then my mum has also had melanoma. She's had, fortunately, it's all okay, but it's definitely never left her and her family. So this is something that has sparked my interest from a young age, and as I mentioned before, is one of the reasons why I chose RPA, because I could do that melanoma rotation, and I'd actually been there as a medical student with my mum when she had one of her melanomas excised. So very apt that I went into this research. So my project, or the project that I'm completing with the Melanoma Institute of Australia, is looking at the volume of metastases of melanoma in lymph nodes, which is what we call stage 3 disease, and looking at whether the volume of those metastases actually predict outcome, so predict survival for that patient, which really has the impact, has the ability to change how we stage melanoma, and has the ability to change how we educate and inform patients on their survival, which is obviously an incredibly important thing to know for patients. So yeah, the project is a very big project, but it is something that I'm so passionate about. It drives it makes it very enjoyable and fulfilling.
What's the time frame for the project, and what findings have you come up with already?
So this project was heavily impacted because of COVID. So it began the end of 2019, but then everything's it's made the collection of data very difficult, and because it means I've had to trawl through 3,500 pathology reports to find lymph node dimensions. So,
Wow.
and I wasn't able to get access to the pathology labs because of COVID. So, it had definitely a lull, but back on track at the moment. We're analysing the data, and even by going through what I've seen so far, there's a big range in how lymph node dissections are reported from a pathology point of view, and if at the very least we can standardize this practice, will make a huge impact in melanoma. And the Melanoma Institute of Australia's actual goal is to have no deaths from melanoma, and which is also drives it's also driving my passion as well to contribute to that, which is great.
Tell me about aging hair.
So I recently completed my Master of Philosophy thesis on hair loss and balding in men. So I get a lot of interest in this topic. So I started this when I was a medical student, actually, and haven't seemed to let it go for many years. So it's basically looking at hair loss in men has been associated with a lot of systemic diseases like cardiovascular disease. But when you boil it down, the scales that they were using to find these findings have never been assessed for reliability. And a lot of them are just cartoon pictures of balding patterns. So how that relates and how that should really inform whether, serious conditions like cardiovascular disease needed to be reanalyzed. As for hair graying, we've almost got next to zero scales on how to measure hair graying. So as a result, we don't know much about it, and we don't know much about the associations of it, although we can see that it happens in quite a patterned way on the scalp in the majority of men. No one knows why or what this might mean. So the thesis was examining both of these aspects of the hair, and we created new scales and validated the scales to assess these aspects of hair, and also did a systematic review on the other scales that existed, which, look, all in all, again, the project was impacted by COVID, and it became a lot less practical and clinical than we had initially anticipated, but still very exciting findings that we hope to publish soon on this topic.
Sounds a little bit like termite mounds showing what's underneath the earth, and from an earth scientist point of view, being able to see what's happening. But do you think hair can really become an indicator of some really significant disease that's lurking within somebody with aging hair?
Exactly. Yeah. So that's and I suppose that's where we might one day get to, is just how high blood pressure or high cholesterol or other risk factors are known and proved to increase the risk of cardiovascular disease. It might also be that the gentleman with the bald patch at the back of his head, or even with the very receding hairline, that might actually indicate an increased risk of cardiovascular disease through the androgen receptors on the scalp and all kinds of complicated things. So, yeah, I mean, and it would be a pretty quick way of knowing just by seeing what's there, but also how graying relates to balding has also never been looked at, and whether graying is associated with a particular subset of neurological conditions has been postulated in case reports and things. But without a scale to measure graying, we haven't been able to make any advancements in these associations. So it's all a very novel project that has been very exciting to be a part of.
Did it see you lurking around a lot of barber shops in inner city Sydney?
Yeah, look, I've individually assessed and chatted to 250 men about their hair graying. So I run out of jokes pretty quickly, but it's been a very interesting experience, an exciting thing to be a part of, particularly in such a novel area.
Absolutely. Where do you see your future in 15 to 20 years?
Yeah, so I do like to think about sort of my 10-year, 15-year or 20-year plan. And look, I can see myself in a rural area practicing dermatology. So I'm particularly, one thing I might mention is coming from a place like Walgett. A lot of people ask me, "Oh, you're going to go work and live home," but Walgett barely has a GP, let alone a specialist dermatologist. But I can see myself not only residing in a rural area as like a resident dermatologist, but certainly providing outreach clinics to surrounding areas through the Rural Doctors Network, and with the help of the Royal Flying Doctors Service, making that possible. But ensuring that the outreach clinic services that are provided are actually providing benefit to the community and not causing more harm than good, and ensuring that there's adequate follow-up for those patients, that when a dermatologist isn't there, that the GPs are supported to be able to follow up with results or be able to manage things. So lots of thought go into it. And yeah, in terms of linking palliative care with dermatology, I mean, I'm sure that in rural areas, unfortunately, I'm going to come across advanced diseases, particularly in the skin cancer realm, that have just gone too far, too long undetected. And I have no doubt that is something that I will experience a lot more in rural areas than what we do in here in Sydney. So it's having that skill will be incredibly important, as well as having a network community of like-minded people and GPs and allied health to really help support me in my endeavours.
Now, you're an MDA national member, and MDA national sponsors this bursary. Have you found to date that you've needed MDA's advice or support in any instance? And have you utilised any medico-legal sessions they've run? Have you found that particularly useful?
So thankfully, I haven't needed to seek any advice or support, which is good. Although I do really enjoy the workshops that they run. So even just last night, they had a workshop on an introduction to mindfulness, which was as part of their series of the health and wellbeing webinars that they're running, which certainly grabbed my attention and was something that I'm trying to build into my skill set at the moment, being the sort of junior stages that I'm in, because I want to ensure that, again, this is a habit of mine to look after my mental health, because if I'm going to live a successful career in a rural area, I need to get that sorted, and that needs to be an area that I continually nurture throughout my career. They also have awesome workshops on interview skills and career planning, which I've definitely learnt a lot from, and really anything in between. Their workshops are extremely well run, and I really enjoy them a lot. Yeah.
Is there enough emphasis on mindfulness and mental health for junior doctors and interns nowadays? Is it a growing area of awareness compared to, say, 10 years ago, do you think?
Well, yes, I think, I mean, I can't speak for 10 years ago, being only 3 years into my journey, but there is, and I think it kind of changes which hospital you're in. I know at RPA they have great support in that field for junior doctors through the MDOK programs, and I felt very nurtured there as a junior doctor, and it was a really, really great place to practice. But there's still a lot that can be done, and I don't have all the answers for that space, but I think it does help when organisations like MDA National are supporting this, and not just having workshops on all this medical learning that we can do, and but really saying, hey, it's okay to take, a significant portion of time to work on this skill, which is your mental health, because it's, particularly with COVID, etc., and compounded by the fact that you can't even, I couldn't actually physically be anywhere near any of my colleagues as a junior doctor, has taken a toll on all of us. So we've had to be quite resourceful in how we combat that.
Yeah, absolutely. Well, it's been great speaking with you today, Isobel. Thanks very much for your time, and best wishes for your future medical career.
No problem. Thanks, Patrick.
And that was Dr Isobel Pye, who in 2023 has opted for a tree change and gone back to her roots. She's now working as a GP registrar in Orange in central west New South Wales, after deciding that a thorough knowledge of general medicine is vital for any doctor, regardless of the field they ultimately choose to work in. She's currently living on a small farm with her dogs, chooks and horses, while also completing a Master of Medicine on the topic of skin cancer. I hope you've enjoyed this podcast, and I look forward to having you tune in again. Until next time, happy days.